Hello, I'm Chuck Kahn, editor of Radiology Artificial Intelligence for the RSNA, and the title of this presentation is Be an All-Star Manuscript Reviewer. I have no conflict of interest. The objectives for the presentation are to understand the manuscript review process, describe the most important criteria to evaluate a manuscript, and describe the special considerations when reviewing work about artificial intelligence in radiology. In this presentation, I'll describe the process of reviewing manuscripts and why timeliness is important. We'll talk about the content of reviews, the various guidelines and standards that are available, and approaches of critical thinking when looking at manuscripts. And we'll touch briefly on some of the ethical principles related to providing a review. Here I've outlined a typical timeline, and it applies to the Radiology AI journal as well. When an author submits a manuscript, the journal office reviews it initially for completeness, making sure the figures are present, to make sure that there's an IRB approval or ethics statement, and to make sure that the authors have appropriately disclosed any conflict of interest and provided necessary documentation. Once that information is completed, the manuscript is sent on to one of our deputy editors, who previews the manuscript to assure that the work is appropriate for the journal, that it is sufficiently novel and has at least a baseline level of scientific value, and worthy of consideration and being sent to review, and then chooses the reviewers for the article. That process initially takes 1 to 3 days for the office review, and then the deputy editors typically have up to 5 days to preview the manuscripts. Once the reviewers receive the invitations, we give them typically 14 days to provide their review, and their job is to decide if the work is important and if it's scientifically valid, and they serve as consultants to the editors. Once the reviews are completed, the manuscript is returned to the deputy editor, who puts together the information from the reviews and with his or her own opinion of it as well, and provides a recommendation on to the editor. The editor then takes that information into account and makes a decision whether to accept the manuscript, to send it back to ask for revisions, or to reject the work outright. And typically in many journals, the decisions at the editor level, before we get to that, there's a consensus discussion where the deputy editors will get together. With our journal, we have a weekly teleconference. And for manuscripts that we're considering taking forward, in other words, we're going to ask for revisions, those papers get discussed by the group, and we have a consensus decision as to whether or not to offer a revision. In this whole process, as you can imagine, there are a number of ways that things can be slowed down, and to respect our authors, we really want to make sure that the review process goes quickly. So as a reviewer, it really is important to respond promptly when you receive an invitation. And in fact, I tell people a quick no is actually better than a slow yes, because if you respond, no, I can't do it, it allows the editors to go on to the next person on their list as a potential reviewer. If you're not sure if you're going to have the time available, it's really better to say no, unfortunately. And you can, in most journals, provide the dates that you're going to be unavailable. The most important thing in all of this, of course, is if you commit to review a manuscript and to do it within a certain time period, such as 14 days, it's really important to honor that deadline, because very often it's the reviews from the reviewers that we're waiting for in order to provide a decision back to the authors. When you perform a review, the important information that we need is for you to help us identify the strengths of the work, the timeliness of the topic, its novelty, whether the sample size being analyzed is appropriate, and whether it's work that's been done before. If work has been done with 50 or 100 cases previously, and the current study purports to show 10,000, that's important work. If 50 or 100 studies have been analyzed before and the authors are providing 3, that work may not be so important. It's important to consider the weaknesses in terms of scientific concerns, methodology, lack of generalizability, and then to provide specific comments, ideally with page and line numbers, so that the authors can address those and work to improve the manuscript. It's important, too, to focus your review and to make it constructive. In much of this, as in so many things, you want to apply the golden rule. You want to do unto others as you would have them do unto you, and seek to improve the author's work. The goal is not to tear it down, it's to help make the work better and to assure that high-quality science makes it into our journals. You can help the editors by, again, identifying weaknesses in the manuscript, describing the scientific quality of the manuscript in front of you, and giving some sense of the priority of the work. You know, is this an article that you would want to read in the journal? So as I said, the golden rule applies here. Be constructive, try to improve the work, and most importantly, maintain confidentiality. Your ability to review a manuscript is a privilege. You are getting the opportunity to see someone else's work 3, 6, 9 months before it will be released to the public. And as a result, it's expected that you as a reviewer will not use knowledge of that work. You'll not plagiarize it, you'll not share it around, and it's really important that you preserve the privacy and confidentiality of the work that the authors have done. The rewards of reviewing are many. For one, you will be recognized as a reviewer. Our journal and others will put out a note of appreciation. There are services such as Publons that let you gain academic credit for doing reviews. For our journal in particular, and for most of the RSNA journals, invitations to become associate editors and part of the editorial board are in fact based on the quantity and quality of reviews that are provided. And it's just an opportunity again to see work that's being done, to stay current in your own field, and to really read some interesting and exciting manuscripts. So let's talk about some of the general criteria for doing a manuscript review. Before you begin, one question to ask is this manuscript submitted in the correct category? Some works are put forth as review articles, some as brief reports, some as full-length original scientific research studies. And it's important to understand that the work that the authors have submitted matches the category that they've chosen. Is there any potential conflict of interest or bias in your review of the work? It's not uncommon that someone who works as in a competing lab or organization may be chosen as a reviewer because you have similar expertise. But if you feel in some way that your review of the manuscript in some way is compromised, it's really critical to let the editors know about that. If, for example, in reading the manuscript you say, I think I know who the authors are, because I remember seeing a presentation at a national meeting, it's appropriate to let the editors know. They may still allow you to go ahead with the review, but it's important to provide that information, because we need to make sure that our process is unbiased. And again, it's the same way that you would want your manuscript to be treated if you submit it. And then, other questions to ask: is it important work? Is it something that should be published? Is it work that has been published before? And for our journal, that does not include preprints. We allow articles that have been released as preprints, we consider those to be the same as meeting presentations in a way. But if some work has been published in whole or in part previously, that's again something that as a reviewer, it's really important that you let the editors. So then the review goes through the parts of the manuscript, the abstract, introduction, methods, results, discussion, and also important to take a look at the figures, the tables, references, and then to provide some summary of the work as part of what you do for the review process. And we'll touch on each of them. The manuscript's abstract should summarize the work and describe each of the sections of the paper, and it should do so appropriately. It's important to look for any discrepancies between the abstract and the rest of the manuscript. Because manuscripts are often revised several times over, it's possible that, for example, the number of cases that was analyzed might be different in the text of the manuscript from the abstract. So it's important to look for any discrepancies between the two. Also important to note that the abstract should stand alone. It should be understandable and readable without having to read the entire manuscript. So those are really the two things you want to look for in the abstract. The introduction of the manuscript should be concise and should clearly define the purpose of the study. It should explain why the study is important and define any terms that are going to be used in the manuscript. The introduction also should present a well-defined and testable hypothesis and explain why that work is being done. The methods section of the manuscript then lays out the approach that the authors have taken to test that hypothesis. The methods should be reproducible, and they should describe to you how the work is done in sufficient detail that another investigator actually could reproduce the work ideally. The authors should justify the design of their study. They should explain why they chose the model they did, why they looked at the number of cases that they did in order to test their hypothesis, and the methods should actually test the hypothesis to provide a result. The results section then should clearly lay out the output of the author's methodology, and the order of results should parallel their description in the methods section. It's also important to look critically at the information that's been provided. Are the results reasonable? Are they in any way unexpected? And are any of the results not tied to the methods? Ideally, the information that's presented in the results should go side by side with information that describes the procedures in the methods section. Then the discussion section of the manuscript should summarize the results, not represent them verbatim, but to provide a higher level summary to help readers understand the results. The author should take the results and place them in context, relate them to prior literature, indicate the impact on the field. It's also important that authors describe any limitations of their study and to take the work that they've done and envision how that could be applied in future studies, and particularly to describe work that they might be doing going on from there. When one looks at a discussion, you want it to be concise. Has the hypothesis been verified? And did they answer the research question? Again, any discussion of unexpected results, limitations, and next steps. Reviewers are also asked to look at the figures that have been provided for the manuscript. Are they necessary to the understanding of the work? Are they understandable? Can you read the information within the figures? And are they appropriate for the work that's been provided? Same thing with the tables and ideally with the references. For artificial intelligence manuscripts, and particularly for those submitted to our journal, there are a few other criteria and things that are important to be considered. First off, there are a variety of standards for journal articles that have been applied, and some you may be familiar with, such as STARD, which is used for diagnostic accuracy studies, Consort and Tripod, which have now variants for AI research, and the STARD AI guideline is in progress. At Radiology AI, we've actually put together the Checklist for Artificial Intelligence in Medical Imaging, or CLAIM, and it's a guide for authors and reviewers. And it's, as the name suggests, a checklist, and one can go through and see the different components of it, and I'll walk through some of these. It's out on the web at rsna.org/claim. You can download both the checklist itself and an accompanying manuscript article that was published in our journal that explains the various elements of the checklist in greater detail. When one looks at AI manuscripts, there are a number of particular things that are important to consider. First off, the hypothesis that the authors have provided. Is it qualitative or quantitative? Are they looking to do a prospective or retrospective evaluation? And are they looking to demonstrate the feasibility of a technique, or are they looking to demonstrate the performance of a technique and to compare it, say, with that of human physicians or others? In terms of the data that are being submitted, one wants to think about de-identification procedures and data protection, any ethical concerns about the use of the data, and then particularly how the data were prepared before being submitted to the AI algorithm. The use of techniques such as data augmentation in particular is important. It's also important to consider the way the data were partitioned, and then to think as well about the ground truth information. We'll talk about each of some of these areas in a little bit more detail. For the AI model, important considerations include the architecture, the software being used, how the model was initialized, if there was any pre-training or transfer learning that was applied, how the hyperparameters were chosen or were adjusted along the course of the way, and any particular training rules that were used to develop the model. And when it comes to the evaluation of the model, to think about what metrics were used, what kind of sensitivity analysis was conducted to assure that the answers that were obtained were correct, whether the model was tested on external data or only on the data set that was used as part of training related to the training data set, and what kind of statistical analysis was conducted. So when we think about the data, we want to ask, where did the data come from? How were the variables defined? And one area that we ask people to use where possible is the Common Data Elements initiative that has been undertaken by the American College of Radiology and the ACR out at radelement.org. But also, when one thinks about the data, to look at the inclusion and exclusion criteria. How was the quantity of data determined? Was a power analysis conducted, for example? And how well do the training data match the intended clinical use of the data? We think about external validation because there have been challenges in this. There was a very nice study back in 2019 by Kim and colleagues in the Korean Journal of Radiology that looked at 516 published studies on artificial intelligence in medical imaging. They found that only 31 studies, 6%, had performed external validation, and none of those 31 studies had adopted all three features that would really allow for a high-quality analysis. As the field is maturing, we're starting to see more and more of these studies, but it's important to think about this in terms of the information that people are providing to you. That radelement.org website is a repository for common data elements, as I mentioned, in radiology, and it's effectively a data dictionary of the variables that can appear and be produced by AI software and incorporated into reports. When we talk about de-identification of imaging information, we know that much of the information is stored in the DICOM header. And in addition to the conventional tags that indicate medical record number or date of birth or the patient's name, many manufacturers also include what are called private tags that may carry some piece of information that actually includes protected health information and could reveal the identity of a patient. It turns out that in medical imaging, we have a number of other challenges. In fact, jewelry, including necklaces that we've seen that have a patient's name on them, medical implants, such as pacemakers, can have a serial number that is visible on a radiograph that could reveal the identity of a patient. Various burned-in labels, such as in ultrasound images. And it's also a fact that from head CTs and MRI images, one can reconstruct 3D facial views that can actually be used to match a patient against a database such as that of driver's license photos, for example. Not only the image information, but the text information of a radiology report can reveal a patient's identity. As you might expect, very often radiology reports will include the name of a patient or perhaps their physician or the date of an examination. There are a variety of techniques that seek to hide that information or change it in such a way that in the event that the de-identification technique misses a name, that still doesn't allow someone to capture that piece of information. And another question is how the ground truth of these examinations is determined. Obviously, the ground truth should be the reference information should be well defined, but it's also a question of who or what actually did the annotation of the data. What were the qualifications or training of the people who did it? Were they expert radiologists? Was it medical students? It's not that you can't have people who are not physicians who are able to perform the evaluations, but it can make a significant difference in terms of the quality of the information that's provided. If more than one person was involved, and it's better if it does involve more than one, how did the authors assess inter-rater or intra-rater variability? And in the case where there was a discrepancy with multiple readers, how was that difference adjudicated? All of that information should be described in the methods so that it can be understood. Some of the greatest amount of work in going into these AI systems is in preparing the data and this whole notion of data wrangling. Authors should describe the software, the version number, the libraries, any particular options that they used. It's particularly important for them to describe how they may have done normalization of the data. It's often the case that in order to apply many of the AI tools that are available, one has to change the image matrix size. Typically in radiology, we require things 256 square or 512 square images, but those may have to be reduced to something like 224 square. Also, the bit depth becomes reduced. We go from a typically 16-bit grayscale image to an 8-bit grayscale image encoded as red, green, blue coding, such as done for photographic images. If the authors have used data augmentation to extend their data set, it's very important to understand exactly how they've done so. Very typical, people will flip images horizontally or vertically, perhaps do some affine transformation or sliding or rotation. It depends on the kind of imaging that's being done. If it's a head CT or MR image, doing a left-right flip may be perfectly appropriate as a way to do things. If it's a chest radiograph, then no, such a flip is not justifiable. So all of these things, in terms of the information that's presented, one has to make sure the authors have provided clarity. It's also key to understand the way the data have been partitioned. Typically, 70% of the data are used for training. About 20% may be used for tuning or validation, and then 10% is used for testing. It's critical that the images or the whatever sources of data, pieces of data are being used here are disjoint and should be disjoint, separated at least at the patient level. There are a variety of architectures for neural network models that authors can use, and it's important that they present a description of them, at least to tell you which model they're using. And also to note the metrics that they're using to judge the quality of the AI model's performance. And there are a variety of them, very common, such as the Dice similarity coefficient, the Jacquard index, or IOU, and the Hausdorff distance. They're just a couple of the various metrics that are used in different types of tasks. Also key to make sure that one identifies whether or not the system is learning irrelevant features. Here is an example where an AI model was trained at 2 institutions to detect pneumonia. One institution had 30% of the cases had pneumonia, and in the other one, 1% of the cases had pneumonia. And when they asked the AI model, what is the key feature that allows you to determine whether or not the patient has pneumonia, the computer said, it's the letter L. And in fact, it was detecting the shape of the radiographic marker that was being used in the 2 different centers. And that was the clue that told it whether or not the patient had pneumonia. Clearly an irrelevant feature, but if the authors haven't tested for those, performance can look good, but in fact be quite poor. One has to look for leakage. This is the unintended use of known information as unknown. And in fact, a risk factor that may go into the future may be used to predict the future. That's inappropriate. Or what's called validation leakage, that some of the ground truth from the training set may propagate into the validation set. For example, if the same patient is used for training and validation. There are a variety of techniques to conduct the evaluation. Depending on the size of the data set, one can use a technique such as k-fold validation, where you split the data set into k parts, and you train the model on k-1 of those, and then on those cases you do that, and then you repeat that process for each of the folds. Sometimes you may do what's called leave one out, where you take out of, generally for a rather small set of data, you train on, if it's 100 cases, you train on 99 of them, leaving that one out, and then test how that model performed on the one, and then take out each of the other cases in turn. It's important that the authors describe the evaluation techniques that they've used. Most of us are familiar with receiver operating characteristic analysis, but there are a variety of other ones. Calibration curves, confusion matrices, and review of misclassifications, and I'll describe. The receiver operating characteristic is based on an assumed binormal distribution. In other words, that both the normals and the abnormal cases, or the 2 different classes of cases, follow a normal distribution, a Gaussian curve. Where the best operating point is on that curve, however, depends on the task at hand. And in some cases, it's important to achieve sensitivity, in other cases to achieve specificity, and others, based on the relative costs or utilities, it may be finding the point that on the curve that parallels a given line, for example. So there is some sophistication with this, and in fact, it's not always the best ROC curve in a way, unless one curve completely dominates another. One of the techniques that is not as familiar, I think, to many authors and reviewers is that of calibration. And here, the idea is if, let's say that an AI model for a certain group of cases says the probability of cancer is 40%, then the model is well calibrated if for that group you actually see that 40% of those cases represented cancer. And one can plot along a diagonal line here, as you see here in a real-life example, for each of the deciles, what the actual prevalence of malignancy was compared to the estimated prevalence. And that gives one, it should follow this diagonal line, and that should indicate that the model is well calibrated. It's really helpful too if authors provide examples where their model works and doesn't work. This was, the figures on the left are actually from the very first manuscript published in the Radiology AI journal. And the authors here highlight both false positives and false negatives of where their AI model thought there might be fractures. And it's useful to understand that because it shows avenues where the work has room for improvement. It shows areas that will require some further research and potentially could require and guide the development of a model. And also, as someone who might be using such a tool as a clinician, to understand what the potential failure points are of that model. And then the other is this matrix, as you see on the right, which is called a confusion matrix. And the idea is it shows for the ground truth and for the deep learning model, the AI model, what the concordance was and where the misclassifications might have been. And again, it provides useful information to help understand the potential failure modes of an AI tool. So in summary, we want to make sure that a manuscript represents high-quality science. The hypothesis should be well-defined, should be testable, and should be ideally innovative. The methods should be appropriate to the problem as stated. They should be described in sufficient detail and use the correct metrics. The results should provide enough information at an appropriate level of detail that we understand how the system worked and can trust in its output. And the discussion of the manuscript should then summarize those results, place the work into context, describe the limitations, and envision future work in the field. This may be your manuscript as you submitted it with your relatively simple idea. And of course, after peer review and revision, it may look a bit more like Frankenstein's monster. We hope that that's not what the review process does to all of our work. But reviewing provides a critical opportunity to help assure the quality of science that appears and to help lead our fields. So with that, I thank you very much.